Good afternoon and welcome to today's COVID-19 update. I'm Heather Fairbairn and I'll be your moderator today. Before we begin, allow me to introduce the Honourable Tim Houston, Premier of Nova Scotia, and Dr. Robert Strang, Chief Medical Officer of Health for Nova Scotia. Premier?
Thank you. Good afternoon, everyone. Before we begin, I'd like to send my sincere condolences to 3 families who are grieving the loss of a loved one who passed away because of COVID-19 just since our last briefing. In total, 110 Nova Scotians have lost their lives to COVID-19. And nothing I can say will ease the pain of those families and communities, but please do know that our hearts are with you during these difficult times. It was 2 years ago this week that the first cases of COVID-19 were being seen in China. And today, here we are hearing about a new variant of concern. So we need to see what the science tells us about this variant, but no matter what, we know that vaccination is the best way to protect yourself and your family. Vaccinations began this time last year with healthcare workers, and now 84.9% of Nova Scotians have at least one dose, and somewhere in the range of 81, I think it was 0.7, something like that. 81.7 are now fully vaccinated. So, and thankfully, some of those will start to include the children 5 to 11 years old. So, thank you to all of those who have made the right choice and have gotten vaccinated. And I also send my thanks to those who are employed under vaccine mandates, who stepped up, got vaccinated, and put the people that they are working to support first. So thank you for that. Our frontline providers showed their leadership and care with 99% vaccination rate for those who have responded. The civil service stepped up too and got vaccinated with also 99% of those who are responding having at least one dose. So thank you to each and every one of those people. The mandates were successful, and we haven't seen any widespread impact on our systems since the November 30th deadline. It's also been wonderful to see parents and guardians booking appointments, and they've been booking them at a very rapid pace, and Dr. Strang will talk further about that. So as a result of that, we will see our overall vaccination rate rising in the coming days as the 5 to 11 vaccination rate ramps up. I know that some are concerned about vaccinations of younger children, and that's understandable. That's the job of parents and guardians is to be concerned about things that impact their children. But the benefits of vaccination far outweigh any concerns. The vaccine is safe and it's effective, and our children have had a hard time during the pandemic. They've lost time away from school. They've lost time away from extracurricular activities. They've missed out on playing with friends and so many other activities. We all know the impacts on all of our families, but children in particular. So we need to get the vaccination rates up so that we can continue to see the return to normalcy. We have yet at this time another school closed this week, closed to prevent the spread of the virus. So please, if your child is old enough to get vaccinated, please make that appointment. Many of the cases we are seeing now are in unvaccinated children. So we can put a stop to that. We just have to increase the vaccination rates. So to help, we're adding 2 days to the holiday break. For students as well. School will now resume for students on January 6th. And I'll hand it over to Dr. Strang now to talk about the epidemiology and really provide a meaningful update on the vaccination program. So, Dr. Strang.
Thank you, Premier. Good afternoon, everybody. And I, too, want to offer my condolences to the families mourning the loss of loved ones who've recently died of COVID-19. We continue to see new cases of COVID-19 in Nova Scotia during this fourth wave. There is ongoing transmission in the Halifax area into East Hants and Truro, and most of the cases are in children aged 5 to 11. Thankfully, we've not seen severe illness in this age group. The outbreak in a defined community in Northern Zone mentioned last week is winding down, and that there has been no sign of spread into the general community. Unfortunately, a cluster of cases associated with St. Francis Xavier University was reported last night, and we expect additional cases in the coming days. Public Health is working closely with the university to understand and manage this evolving situation. However, overall, Nova Scotia continues to do well in managing this fourth wave. There's been a lot of talk about the Omicron variant, and I know many Nova Scotians are concerned. We are waiting for more real-world evidence on how it behaves and what impact it may have. But we already know that the way we protect ourselves hasn't fundamentally changed. Follow public health measures and get vaccinated, whether it's your first, second, or third dose or a booster shot. And the same goes as we head into the holiday season. COVID-19 loves gatherings, especially when people aren't vaccinated. But fully vaccinated people can also carry and transmit the virus, even if they may not get sick themselves. So we all need to be cautious over the holidays, regardless of our vaccination status, to protect our loved ones and our communities. There aren't any special or new precautions to take. We just need to keep doing the things that have been protecting us all along over the past 2 years. Get your vaccine. If you're feeling unwell, stay home and don't have visitors, and go online and book a test and isolate until you get that negative test result. We are asking people to avoid out-of-province travel if possible, especially if they're not fully vaccinated. If you need to visit loved ones who don't live in the province, please be careful and follow very strict public health measures where you're visiting. If you have people coming to visit, please make sure they follow the Nova Scotian rules about entering the province and encourage them to be vaccinated before they travel. If you're having get-togethers at your home, there is no physical distance or mask requirements, but you have a limit of 25 people indoors or 50 people outdoors. That's really important. When we gather more in our homes, no more than 25 people for informal, home gatherings. And be careful about the number of social events you attend and the number of close contacts you have with people outside your immediate family and workplace. We can do a lot more this Christmas and this holiday season than we were able to do last year when we were tightly locked down. But we still, I can't say it strongly enough, we still have to be careful, especially about the type and the number of social events that we are engaged in. If you're having a workplace party, a social gathering in a rental space, or just about any other kind of special event, there are no gathering limits or physical distancing requirement, but proof of vaccination is required. And masks must be worn indoors in public places when you're not actively eating or drinking, whether you're seated or standing. And in outdoor events, proof of vaccination is required. Unless it's impossible to set up an entry point. And we do recommend wearing masks if you're in close contact with people outside your close family or social circle, even though they're not required, mandatory under the public health order, but event organizers certainly can choose to make masks mandatory on their own. And a quick reminder, the easiest way for businesses or organizations to check proof of vaccination is getting the app from VaxCheck NS. It gives a quick confirmation for people who are fully vaccinated and have a Nova Scotian or Canadian QR code. It's free and available from the App Store or Google Play. And we strongly want to encourage businesses and even families to get that app. As a way it helps avoid fraudulent proof of vaccination if you're actually reading the QR code. And while we've stopped recommending general asymptomatic testing a while ago, we recognize it's another way to keep gatherings safe over the holidays. So we'll be doing an extra push to make more rapid tests available across the province this month. We're just working on some final details, but there'll be more information coming in the days ahead. In the meantime, you can get rapid tests from pop-up sites and mobile units in communities where cases are higher, and the locations and details are on the Nova Scotia Health Authority website. Incoming travelers can get tests at the airport, and we are starting to distribute more test kits to public school children under 12 this week. If people remember, we did an initial round of sending test kits home for elementary age kids, and we're doing a second distribution this week of test kits. And we've also made take-home kits available for children from 3 to 11 in private schools, licensed and unlicensed daycares, families with children at home, and homeschooling families. So we've expanded the availability of these rapid test kits for kids outside of the public school system as well. And now for an update on our vaccine program. As of today, 81.7% of Nova Scotians are fully vaccinated. And as we continue rolling out vaccines to children and booster doses, we know that our rate will continue to go up. Last week, I had the pleasure of joining 8-year-old Jack Woodhead for his the appointment for his first dose of COVID vaccine. And I want to thank Jack and his family for allowing me to join them for another milestone in our vaccine rollout. I have to say, it was quite exciting to be there to see the first child, 5 to 11, immunized in Nova Scotia. That is a huge step forward now in our efforts to control this pandemic. And so far, almost 29,000 of 65,000 5 to 11-year-olds, and that's almost 45%, have had a first dose or an appointment scheduled. So that's quite something. We've just begun immunizing a week ago. I certainly recommend COVID vaccination for this age group. So if you haven't booked an appointment for your child, please book it now. And if your child is nervous about getting a vaccination, and that's not uncommon, it's actually quite normal, the IWK has a lot of resources online to help with this. Of the almost 46,000 people aged 70 and older who are currently eligible to get a booster dose, just over half have either booked an appointment or received their booster. That's good. That means there's another half, though, who haven't yet. Some of them may not be, through that 6-month wait period, but many of them are. So we are encouraging anyone who's 70 and above to schedule their booster dose as soon as possible. This booster dose will improve your protection and help you enjoy a safer holiday season. So please book an appointment now if you're eligible. Last Friday, the National Advisory Committee on Immunization made additional recommendations for boosters and other aspects of vaccination. First, let's talk about boosters. NACI now recommends that everyone 50 and older and all frontline healthcare workers should get a booster 6 months after their second dose. NACI also supports booster doses in people aged 18 to 49 years. Nova Scotia is accepting all of NACI's recommendations, and planning is underway to roll them out. But I do want to be clear that our priority continues to be getting everybody vaccinated with their primary series. And for most people, that means 2 doses. We're also prioritizing boosters for people 70 and older, residents of long-term care facilities, and healthcare workers and designated caregivers who got their first 2 doses less than 28 days apart. These are the people who are at greatest risk of having waning immunity and the need for a booster. And as we plan, we also need to factor in vaccine supply, system capacity, the number of people eligible in any given group, and making the necessary updates to our online booking system. Once plans are complete, we'll announce the specific dates that the booster doses can be booked for Nova Scotians between ages 50 through 69. And for those under 50, we will revisit boosters in the new year. Evidence shows that people in this age group still have very good protection against severe illness. Plus, most people in these age groups are still much less than or have a ways to go till they reach that 6 months from their second dose. And I also want to clarify that booster doses for Nova Scotians who are immunocompromised. For those who meet the NACI definition of moderate to severe immune compromised, we have already made you eligible to get the 3rd dose in your primary series, and now you will be eligible to get a booster dose in 2022. And just to be clear, that booster dose must be at least 168 days after receiving your third dose. So that means the people who meet that criteria for as moderate to severe immune compromised, we're asking them, if they haven't already, to get their third dose now, and it'll be likely May into June when they're eligible to get their booster dose. But, excuse me, but we want to let them know now that we are adopting that NACI recommendation. And the more we learn about COVID-19 vaccines, the clearer it is that mRNA vaccines, Pfizer and Moderna, offer the best protection against the virus and are now the COVID vaccine of choice. That being said, we know that some people have decided that they want a viral vector vaccine or no vaccine at all. So some viral vector vaccines will be made available this month for people who won't get vaccinated any other way. Late next week, anyone 18 years or older who will be able to book an appointment online for the one-dose Janssen or Johnson & Johnson vaccine. There are limited doses, and they will only be available at select clinics. And later this month, we do expect a shipment of AstraZeneca, and more information around its availability will be released when we have certainty on that. But I do want to emphasize that the strong recommendation from public health is to get an mRNA vaccine. There's also guidance from NACI on which vaccine is best for people aged 12 to 29. NACI now recommends Pfizer and not Moderna because the rare risk of myocarditis and pericarditis associated with mRNA vaccines appears more common after Moderna than the Pfizer vaccine. So if you're in this age category, 12 to 29, and you have an appointment to get Moderna, we strongly encourage you to reschedule to get Pfizer. As we've rolled out this enormous vaccination program, there have been many, many people doing tremendous work to make it all happen. And yet, unfortunately, I continue to hear stories of immunizers, vaccine and symptom checkers, clinicians and public health staff being verbally abused by people who are frustrated with aspects of our pandemic response. The latest is pharmacists who are providing vaccine and clinical providers who are assessing people for medical exemptions. I want everybody to remember that these dedicated professionals are carrying out a program that government and public health put in place. They deserve our thanks, not your anger. This pandemic keeps dragging on, and we are all tired and frustrated. We've gotten this far by following public health rules and by being kind to one another, supporting one another and caring for one another. We can't stop now. The pandemic will end, and we will be here together when it does.
We'll now take questions from media in the room and on the phone, beginning in the room. Go ahead.
Dr. Strang, regarding the mandatory vaccine mandate, when are we going to find out about the remaining 2,000 or so people who have not reported yet their status? What's the progress like on making those final numbers available?
Well, what I know is that many of them are off work. There's always a small percentage of people who are off work for a number of reasons, and they haven't worked in. So I think the various employers are working through to clarify that. But what we do know is that the people who are at work, the vast majority have reported, and as you saw from the Premier, almost all of them are saying that they've had at least one dose of vaccine.
What more can you tell us about the cluster at St. FX? Do you have evidence that it's related to breakthrough cases? There is no mandate at that school. How concerned are you?
Today's the first day of the investigation, so I know that the public health team was having that meetings today. They have a meeting at 2 o'clock with the St. FX administration, so we'll learn more as this investigation unfolds. But I certainly do expect that we're going to see more cases in the days ahead from this.
Dr. Strang, is it in any way related to the ring ceremony that was there, last week?
I think there's the ring ceremony, and then there's both sanctioned and informal social events. Anybody knows what happens around that. There's lots of informal social gatherings among students, etc. So part of what we're looking at. But what we do have already confirmed is that the formal events, we're closely following the public health protocols around requiring proof of vaccination, masking where necessary. But we'll as we start to follow up the cases and find out what their activities were, we'll get more information on what happened. happened. But we're clearly looking to make, if there are indications of non-compliance with public health measures, whether it's proof of vaccination or large, parties, more than 25 people, we are going to be working with our enforcement colleagues to bring that to their attention and have appropriate enforcement actions as well.
What
What kind
you're
of
working
numbers
on,
could we be looking at in that cluster?
Sorry?
What kind of numbers could we be looking at?
I'm not going to speculate. We're at the very beginning, and so but I certainly we'll anticipating to have starting tomorrow, we'll see an increase in case numbers coming from this outbreak.
so how many do you have now from that, in that cluster?
I have to go back to the office after this and get an update from public health. As I said, they were just pulling together the outbreak team and having their first meetings today, and then meeting with the university administration this afternoon.
Okay. I
Here's
get
what I would say,
it.
just like to just add in on the St. Effects thing, because I think it's important. Our understanding is that the sanctioned events on campus, we're closely following the rules in place. Obviously, around a weekend like that, there's all kinds of off-campus things. So public health is actively investigating any of those situations. And I guess the message would be, particularly to those establishments that may have hosted an event, if you weren't following the rules, the public health's we're going to find you, and we're going to fine you. And what my message to people that were in Antigonish on the weekend would be that if you hosted an event where you weren't checking for vaccinations or you weren't following the rules, it's time to stick your hand up and reach out to public health and work closely. Obviously, there was a lot of people in Antigonish for a very, very exciting weekend. So we want to make sure that we have all the information we need. If there's issues, we're able to contain it. But it's probably just as good a time as any to remind all of our operators and establishments. I am hearing kind of third hand and otherwise of people, like places that are getting a little lax on checking vaccines. This is not the time to get lax. We have to be checking vaccines. There's no room for easing up on that. And we're also probably going to talk a little bit more about, I don't see a lot of establishments using the QR reader. It's very effective. It's very easy. We need more people using that QR reader. It's very accurate. It's easy and it's accurate. And this is the time to start making sure we want to see more of that in place. And Dr. Strang, I think, alluded to it as well, but that's an app that can be downloaded. I have it on my phone. So if you're hosting even something at your house, so heading into the holidays, and you could have that app on your phone, and you could check your 25 or less guests that are coming to see you if you want to make sure that you're around people that are vaccinated. Vaccination is the best way to protect yourself and your family. So just I want to make that point on the St. Effects, that anyone who hosted any kind of event there who has some concerns, it's time to reach out to public health and talk about that.
Dr. Strang, I hear an awful lot of anecdotal stories about falsifying vaccine, proof of vaccine. I'm wondering if your office has been tracking any of that. I have one more credible story about someone selling exemption certificates, and I'm just wondering, are you tracking that? Are you aware of it?
So we're not tracking anecdote. I'm aware of the anecdote. I can personally tell you that people that I know, that my wife and I were out to dinner with, they were offered for $50 proof of vaccination as they were going back to their car. That's one of the reasons we're pushing the QR, using the QR reader, because the QR code makes it less, makes it harder to provide fraudulent proof of vaccination, but it only works if people are actually using the reader. So the Premier alluded to it. We'll be having conversations my colleagues in government, we're looking at working with various sectors around promoting and supporting use of the actual reader, because the reader greatly cuts down on the possibility of having having false proof of vaccination. We're also looking at how we can have in the putting more responsibility on individuals and penalties on individuals if they were found to be using fraudulent proof of vaccination directly in the public health order.
Can I follow up on that then? So are there penalties now for people either selling fake proof of vaccination or people who are using fake proof of vax?
What we're doing is going to make that very explicitly clear in the order and the penalties associated with that. So there's no question about it at all.
But right now, that's
It's a bit
not
of a gray zone, so we're going to make it absolutely clear.
when.
The Premier and I were discussing that before we came down, and I'm going to go after this. I'm going to talk to my legal supports and how we make those changes in the order.
On the QR code reader, I've only been to one establishment in Halifax that actually uses it. I was in Quebec City last month, and every place I went was using it. Is there a reason why there's not uptake in Nova Scotia compared to other places?
So I've had that conversation this week. My own personal experience is the same. So that's why I raised it with colleagues in economic development, and they're going to be working with the restaurant sector, others, and we're going to both promote and support that we have to be, especially places that people are gathering for social events like restaurants, other things. Some are using it, but many aren't. So we're going to make it support them, and it's important that we actually use the reader, because that is how we avoid these fraudulent proof of vaccination.
And I have a technical question. You may not. It's mentioned in the release, but the vaccination numbers today are all out of whack with what they were yesterday. There's obviously a bunch of stuff going on. Can you just explain that?
I think there's a 49 case difference. There was just some auditing, right, and cleaning up some of the numbers.
But so there's over 7,000 newly reported in one day. Is that reflecting the?
Well, I was informed that there was a difference of 49, and that because of cleanup. So you'll have to go back with those very detailed questions, and we can get an explanation for you.
On the
Were you
booster,
talking about the number of people fully vaccinated?
No, the big increase was apparently in the number of first doses. So I'm assuming children got new.
Well, that would have been simply because of the number of kids that all of a sudden we're going to see a bump in our first doses because they, until they're eligible for their second dose. So that would explain that one.
On the booster shot, it's my understanding that it's 50 and up that you've decided that's the group you're going to tackle for now, and then you'll decide later about the rest, or?
What we're saying is we're going to adopt the NACI recommendations, and we're going to be going down in incremental age groups. You'll hear in the next few days about when the time frame for people first 60 to 69 and then 50 to 59 will be able to start making an appointment. What we're saying, if you're 49 or younger, then we'll be doing that later on in the new year for two reasons. Most of those people are not even close to being eligible yet for their 6-month period. And also we do know, and the people in that younger age group, there's really solid evidence that they are at much lower risk of waning immunity than the older age group. So we have to make older groups a priority, as well as, and it's most important to me that we get the 70 plus, because they're at a greater risk than the 60 to 69s or the 50 to 59s. So like we did in the spring, age is an important factor, and we have to give those who, based on age, are at higher risk the first opportunity to get their booster doses, as well as the immune compromised. We still have to make sure that, to me, it's most important that the 5 to 11-year-olds have lots of opportunity to get vaccinated.
Aside from some of the exceptions that you talked about earlier in terms of the booster, will most people be getting Pfizer for the third shot? Is that the intent?
We're going to have Pfizer and Moderna, and so if you're 29 or below, the strong recommendation is that you get a Pfizer. If you're 30 and above, the recommendation would be that if possible, you continue with the same mRNA vaccine that you had previously. So like myself, I got Pfizer, then ideally I'd get a third, my booster, as a Pfizer, because that's the best. But I would also say, if it's going to delay getting a booster to get, to match, then go with your first appointment.
A lot of people in this province got 2 different mRNA vaccines.
Yeah,
So
Pfizer,
which
Moderna,
one should they
and
get?
just take the first you can get
It doesn't
and get the
matter.
first appointment.
Okay.
Dr. Strang, regarding the decision to offer viral vector vaccinations, I'm wondering what your sense is for the demand for this type of vaccine and if you have any concerns about the efficacy.
Well, true. I think the demand is low, given our people who've already had a single dose and fully vaccinated. We have had we've had 250 doses of Johnson & Johnson vaccine, which we've had for the last 2 or 3 weeks, and we have been providing that for people whose employment is in some of them, in the situations like healthcare workers, teachers, where they were mandated to be vaccinated. So if they were saying, I'm not going to get vaccinated, and refuse an mRNA vaccine, well, it's better that they get a Johnson & Johnson, and we know that provides good protection, not as good as mRNA, but it allows them to be back in the workforce. We've gone through that, and now we have a little bit, I don't know the exact number, but we have a small amount of Johnson & Johnson left. And so we're going to open that up to the very small number of Nova Scotians who are saying, for whatever reason, are refusing an mRNA vaccine. Again, it's better that they get some protection from a J&J or an AstraZeneca vaccine than no protection at all and remaining unvaccinated. And so we've got a little bit of Johnson & Johnson, and we're going to get some AstraZeneca. And so the details on how people access that will be made through, as we get the vaccine and through press releases.
And when you,
Sorry, just how many were left over of the 250? Could you give us a range?
I don't have that number. I don't know exactly, right? It's a small number. But again, I'm going to take the opportunity to say, in my mind, it's not a great choice to be saying refusing mRNA for a viral vector vaccine. We know now that an mRNA vaccine is a preferred choice. So it strongly encourage people to think twice and to take advantage of the best vaccine they have available for them and get an mRNA vaccine.
Can you speak to the AstraZeneca? I just don't understand what's happening.
The federal government is in the process of procuring an additional amount of AstraZeneca vaccine and then making that available to provinces and territories.
For those of us like myself,
And we would then make that available for people who are saying, I'd rather go unimmunized than to get an mRNA vaccine. And so we're going to make it very clear to those people that the implications of the choice they're making. But again, at the end of the day, I'd much rather they got some vaccine than none at all.
Has there been
those
enough?
of us like myself who got an AstraZeneca and a Pfizer, you would recommend the Pfizer as the
Absolutely, you should get a Pfizer or a Moderna as your booster dose.
Dr. Strang, can you help me understand the process between somebody saying, no, I will not have this vaccine type, I want viral vector, and then getting that different type of vaccine? Is it made available in a different portal? How does that work?
No, they can. We don't have a small amount of vaccine, and so we're going to have a few pharmacy clinics that people can go to.
I mean, for the first 250 or less who were from this mandate, how did that happen?
Well, there were people who were through their employer said, I will not get an mRNA vaccine, and I'll use the example before, and I'm not picking on the teacher. So again, we're better to have them with a vaccine that provides good protection, but not quite as good, but a decent level of protection, than no vaccine at all. And by getting that, then they can go back into the workforce. So we did that. I don't have numbers about how many, but we made that available because our priority was people who were mandated to get vaccinated. That clearly was our first priority. Now we've done that. Now we're going to, with the remaining vaccine, we'll make available to the general public. But, the numbers of all the requests we've gotten in that I'm aware of in the department, they're very small.
small dozens?
I don't have, that there's, probably in the double digits somewhere.
Has there been an uptick in vaccine bookings in the Cumberland County area following the outbreak there that led to several deaths?
I don't follow vaccine bookings by kind of local geography. We continue. What I do know is that where we have communities where there's like that community and in northern Nova Scotia, we have for the last number of weeks supported but increased opportunity both for testing and vaccination with our mobile vans, increasing other opportunities for those. So we'll continue to do that. Where parts of the province need extra support, we'll make sure that both testing and vaccine have increased availability.
Could somebody explain the extra 2-day vacation tagged on to, I guess, Christmas break for kids in school? What's the thinking behind that? And what about families who kind of made plans, but then will have to find care for those 2 extra days?
I was not involved in any detail in those conversations, so.
Yeah, I think it's something that the Department of Education had kind of come forward with, and I guess we know that anytime there's a disruption to the school schedule, there's a disruption to a lot of family circumstances for sure, and we always apologize for that. But the department just on balance looked at what's happening around and said a couple more days is not going to hurt the academic calendar. If we can kind of get through the holidays and kind of reset starting in the new year, that's better for students and teachers. So,
but if they didn't loop in Dr.
So I was involved, I shouldn't say what, I was involved very early on to say, what about this idea? And I said, from a public health perspective, it does, to give a couple more days after the holiday. In terms of all their other operational details and where I was just in I'm not trying to ditch my responsibility. The concept, I wasn't involved when they actually landed, okay, 2 more days. But the concept of delaying opening of schools for a few days that allows us to see the impact potentially of increased exposures over holidays, I was involved and said, yeah, that from a public health perspective, that makes sense. Where they ultimately landed and all the other reasons for that was, within the Department of Education.
Just to clarify, in terms of your recommendations for Nova Scotians not leaving the province, are you saying no one should leave the province if they had their druthers, or just those who have not been fully vaccinated?
Well, I would say, certainly if you're unvaccinated, but even if you're fully vaccinated, right? We're certainly far more open than, Jean, than we were last Christmas, but we're still in a pandemic. The basic, for me, it's about, we need to slow down our lives and be careful about how active we are. There's more virus around in New Brunswick, Ontario, Quebec than there is in Nova Scotia. So now's a time to enjoy the increased freedoms, if you will, and opportunities we have in Nova Scotia while we're still in a pandemic. But also, let's not go crazy. Now's not the time to be just thinking I'm going to travel all over the country or all over the world. Be careful and cautious is still our watchword. And to me, part of that is, even within the province, how much travel and how many social events and how many people are you going to expose yourself to? Let's be careful and cautious while we enjoy a much less restricted holiday season than we had last year.
We'll now move to the phones, starting with John McGuinness with CTV.
Hi. This is, I suppose it's for the Premier. Mr. Premier, is the province going to set up a COVID economic recovery plan, and if so, when?
Yeah, we have a very detailed economic recovery plan, and we shared it with Nova Scotians for a month over the course of the summer during a general campaign, and that is the path to an improved economic future in this province runs through improved access to healthcare. It runs through making sure people have access to shelter and adequate housing that's affordable, and it runs through increasing the population. So these are the things that are important for an economic recovery, and I think all Nova Scotians have had their say on that.
John, do you have a follow-up question?
No, that's it.
Moving on to Preston Mulligan with CBC.
Yeah, hi, thanks. This is a question for either the Premier or Dr. Strang. A few weeks ago, we talked about the religious gathering in Amherst, and the Premier was frustrated with the speed at which it was taking charges to be laid. But police up there still say that they're working with public health. So what role is public health playing in this investigation? And, if you think charges are warranted, why hasn't that happened yet?
So I know that I've been involved in emails. So public health, Nova Scotia Health Authority Public Health, have handed over all the records that have been requested from them by Amherst Police Department. So all that information sits with the Amherst Police Department. I haven't been involved with any discussion with that police department directly. I can only assume that they're now looking through all that information and doing what police normally do. Do they have enough information and evidence that charges are warranted?
Preston, do you have a follow-up?
No, I'm good, thank you.
Moving on to Adrienne Blanc with Radio Canada.
Good afternoon, Dr. Strang. In the case the situation gets worse, what tool in the toolbox would you use first? Would it be restricting travel or maybe a partial lockdown?
Well, some of it depends on what's driving making things worse. What's driving the increase in cases? So, if it's more travel related, we'd look at how we maybe need to put more restrictions at the border. If it's because of larger gatherings, then we may need to go back to where we were, with gathering limits. We hope not to do that, but again, it'll depend. Your question, the answer to your question depends exactly what are the circumstances that are behind any increase in epidemiology.
Adrian, do you have a follow-up?
No, thank you.
Moving on to Pat Healy with the Laker News. Go ahead, Pat.
Thank you. This question's for Dr. Strang. Can you elaborate on the transmission you mentioned earlier in East Hants at the start of the briefing? Where and what's concerning about it? We're not seeing any exposure sites or school exposures, so just trying to get a little idea of where you're seeing the transmission in East Hants.
Well, we're seeing some improvement there. In the last couple of weeks, there have been a number of schools in that East Hants corridor, and many of the cases were 5 to 11-year-olds. And that now seems to have moved out. We're seeing more activity now in the Truro area. But I was speaking in general in the last few weeks, this trend of what we're seeing moving from the peninsular and slightly off the peninsula, Halifax, into more the suburban area through East Hants into Truro, that pattern that maintains itself. The virus moves from community to community, impacting schools, impacting mostly the 5 to 11-year-olds.
Do you have a follow-up, Pat?
Yes, I do. Premier Houston or Dr. Strang, why is the Janssen COVID-19 vaccine not being made available to all Nova Scotians where Nova Scotia healthcare workers already are? It's available to them.
Well, as I announced earlier, Pat, we've gone through those people who are under the mandated vaccine, and we're the remaining J&J vaccine we are going to make available. In the more details to come in the days ahead for the small number of Nova Scotians who are making that their choice for that viral vector vaccine.
Moving on, we'll go to Chelsea Gould, Truro News.
Hello, thank you. Dr. Strang, in New Brunswick, their health minister has told people to hold off on making holiday plans, and of course you've just made recommendations just now for people to just slow down. Could you ever see yourself getting to the point of saying don't make plans at all?
I hope not, but we will respond if necessary if things don't go well epidemiologically. I think our slow, cautious approach over the last few months has kept us in a place that's different from where New Brunswick is at. They're requiring stronger measures to get things back under control. Hopefully all Nova Scotians hear the message today to be slow and cautious. Enjoy the holidays, enjoy what we can do, but still be cautious about it. And that is what we need everybody to do to keep us from getting into a worse situation and having to put tighter restrictions on.
Chelsea, do you have a follow-up?
Yes, thank you. When you say select about the viral vector vaccines, you say select clinics. Can you clarify if this is throughout the province or in a range of communities, or whereabouts they'll be?
As I said, more details to come. We're working those out. It's just that there'll be a small number of pharmacies, with a very small amount of vaccine, small numbers of people. It doesn't make sense to give it in the pharmacies across the province. So there will be select pharmacies that have these specific clinics. People may have to be prepared if they're making this choice. They may have a little bit of travel for them to get to one of these clinics.
Moving on, we'll go to Linda Pinozzo. Linda?
Hi, yes, thank you. Dr. Strang, a couple of weeks ago I asked you why federally authorized monoclonal antibodies effective against the Delta variant were not being used in Nova Scotia for high-risk patients and early treatment of COVID, and you deferred to Dr. Lisa Barrett and the therapeutics and Prophylactics Advisory Group. I've reached out to them over the last few months, and I'm still not any closer to having any answers. And I also recently contacted the Nova Scotia Health Authority to find out if these treatments were deployed at the long-term care facility in Pugwash, the site of the recent outbreak linked to the phase gatherings, and I received no response. Dr. Strang, you also seem a non-voting member on the advisory group, and I'm just wondering what can be done to ensure that those Nova Scotians at highest risk of hospitalization can get access to this potentially life-saving treatment.
So this is not my area of expertise, and one I defer to the clinicians who are actually treating people, and that would be the Nova Scotia Health Authority. But I do know that we are, for select patients who do meet their appropriate clinical criteria, we are using the monoclonal antibodies as appropriate. But that's all I can tell you. Again, I defer to the clinicians who are responsible for treating patients, and I would encourage you to continue to ask through Nova Scotia Health Authority communications.
Do you have a final question, Linda?
Yes, I do. The proof of vaccine policy and the vaccine mandates have led to, in my opinion, a worrying stigmatization and segregation of a segment of the Nova Scotia population. For instance, last week I was told about an unvaccinated person who went to get an ultrasound at the Bridgewater Hospital and was publicly shamed in the waiting room by both the receptionist and another person waiting there. So these policies do have ugly societal consequences. At the same time, we know that vaccine protection fades and that fully vaccinated people with Delta breakthrough cases can efficiently transmit the virus, including to fully vaccinated contacts. My question is twofold. Dr. Strang, given that vaccinated people can get and transmit the virus, how can mandates and proof policies that exclude the unvaccinated be scientifically justified? And finally, have either of you considered that these policies could be doing more societal harm than good?
So there's a lot in that question. So first of all, it's unfortunate if people, I can continue to ask that people, regardless of the choice they make, are treated with care and kindness. That we certainly know that we've been very clear that people are not to be denied access to health care regardless of their choice around vaccination, and those policies are in place in our hospitals and our other healthcare facilities. I would flip it around and say that being unvaccinated puts other people at risk, and what about the consequences of that? What we do know, and I've said many times, vaccines are not 100%, that there are some people who get breakthrough cases and may be able to spread it to others. But we know clearly with Canadian data that if you're unvaccinated, you're 8 times more likely to become infected. If you're unvaccinated, I think it's about 28 times more likely to end up in hospital. And if you're 18 to 50, I think it's 50 years old, you're about 45 times more likely to end up in hospital. Vaccines work, not just to protect individuals, they protect each other. And having high levels of vaccination protect our healthcare system. Other provinces that haven't been able to achieve as high vaccination coverage rates have had significant impacts on their healthcare system, to the point where there are many people that are now suffering for non-COVID related issues because they can't get appropriate healthcare. So I think you flip it around and say, what are the impacts on all of us by people who choose not to be vaccinated, rather than, and we're in a pandemic. We need to have strong measures. I wish we didn't, but we do. And if we all think about each other, then the choice to become vaccinated, to me, becomes very clear.
Our final reporter on the phone, Steve MacArthur. Go ahead, Steve. Steve, are you there? Come back to the room for one final question.
Question, Dr. Strang. You've mandated that doctors, nurses, people who work within the public health system be vaccinated. However, obviously there are private practices, there are dentists, there are other health service providers who provide up-close and personal care or services. Why don't they have to be double vaxxed to provide that kind of care?
So we made a deliberate choice to start in the healthcare sector with people in facilities, long-term care facilities, hospitals, where it's not just about one-on-one care. There's chance to expose lots of other people. We've said that we'd get through this first round and look at if we needed to add others. We've just gotten through the first round, and I would say if you really look at our high vaccination rates, that there may be a few healthcare providers who are, in their private community-based practice, but by and large, our high levels of vaccine coverage would argue that those numbers are going to be small. I think it's perfectly appropriate for a Nova Scotian who's going to a private community clinic, whether it's their family doctor, a physiotherapist, their chiropractor, ask them, are you vaccinated? And certainly you should be comfortable making the choice about I'm gonna go seek my care elsewhere if that healthcare provider either won't disclose their vaccine status or tells you that they're unvaccinated.
Dr. Strang, sorry, how many childcare centers do you know of that have been temporarily closed during the fourth wave? Can you provide any insight there?
I'd have to go back. I don't believe there may be one or two, but daycare centers have not been a major issue in this fourth wave.
Sorry, that's all the time we have.
Sorry, thank you. The holiday season is now in full swing. It's naturally a more social time of year. First off, Hanukkah just ended, so a belated happy Hanukkah to Jewish Nova Scotians. But this is a very social time of year. We had a couple of questions today. I think Preston and Chelsea asked questions along the lines of what happens if things get worse. Well, let's not let them get worse. Dr. Strang has given us good advice over the course of the pandemic. When Nova Scotians have followed that advice, Nova Scotia has done well. We've gained a lot of recognition for how we've handled the pandemic in this province. So there's lots of ways to protect yourself and protect your family. Vaccination is first and foremost. So we continue to stress. If you haven't been vaccinated, please get vaccinated. It's never too late. And as Dr. Strang said, slow down as much as you can during the holiday season. So let's all have a safe and enjoyable holiday season. But we can only do that if we follow public health. So thanks, everyone.